So now we're going to speak about the Petrous portion of the temporal bone. So this is the part you can see here. You cannot see it from a lateral aspect or a lateral view of the temporal bone. You can only see it from a superior view or an internal view. So if we look here at the superior view, this would be the Petrous portion of the temporal bone on either side. You can see that posterior to it will be occipital bone, and anterior is the greater wing of sphenoid bone here and here. So it's an important structure. It contains the middle and internal ear structures, as well as a lot of nerves, arteries, veins. So the best way to describe it is by using its 3 different surfaces. So if you think, here you can see the zygomatic process going forward. So this here is anterior, this here will be posterior, and this here is its inferior view. So firstly, its anterior view. This part of it will contribute to the floor of the middle cranial cavity. It forms a roof over the vestibule, which is a portion of the inner ear, laterally, as well as a part of the facial canal, which will be running through this portion of the bone. It joins to the cerebral surface of the squamous part of the temporal bone, which is this part here, and it creates the squamo-petrosal suture, which you can kind of see running along here, separating the squamous and petrous portions. Medially, it's going to articulate with the greater wing of the sphenoid, and you can also see from this view the arcuate eminence, which is this part right here. This is a bony prominence that's thought to be present due to the semicircular canals, which are part of the ear structures, which are present also in the petrous temporal bone. So posterior view here. This contributes to the anterior part of the posterior cranial fossa. It's continual with the inner surface of the mastoid portion of temporal bone. So this here is mastoid portion. So as you can see on its inner surface, it's continuous. Here, between those two portions, is a deep sigmoid sinus. So that's a big groove caused by the deep sigmoid sinus, which helps to drain structures from the brain and skull. This is where the opening for the internal acoustic meatus is found. So this here is the internal acoustic meatus opening, and this is going to transmit the facial and vestibulocochlear nerves. You can find out a lot more about them on the clinical page of this website. Posterior to the petrous portion, as I've said, is this deep groove formed by the sigmoid sinus. On the inferior view, here, so just to orient yourself, that's anterior, so inferior view, anterior, posterior. So this is a highly irregular surface, as you can see, and it forms a portion of the exterior of the cranial base. So this is where the stylomastoid foramen can be found, and this here is the stylomastoid foramen, this bit that I'm covering up there. So that is another structure which transmits the facial nerve, which is a cranial nerve, and the stylomastoid artery. Here you can also find the carotid canal, which carries the internal carotid artery. So it's here. You can see my pointer going into it, but you could also see it coming back out of here. So it's a kind of curved portion. You can see the hole there. So that's the carotid canal with the internal carotid artery. And then just kind of medial and anterior to the stylomastoid foramen is the jugular fossa. So this is important, as this is where you can find the glossopharyngeal nerve, which is cranial nerve 9, the vagus nerve, cranial nerve 10, accessory nerve, cranial nerve 11, and the internal jugular vein as well, all found within this structure. So as well as its 3 surfaces, the petrous portion obviously has a base and an apex, and this is what makes it pyramidal in shape. So the base is larger, going down to its much smaller apex. The base obviously is found again between the petrous portion and the mastoid portions on the internal aspect. As I've said, apex is where the internal auditory canal is found, a very important structure. And as well as this, there's a canal called Dorello canal, which also runs through the apex posteromedially, but you can't actually see it because it's within the structure, but that's going to carry abducens nerve.